Hi, I'm Dr. Tina Sagosho, and I am a menopause provider here in Merced, California, and in Roseville, California, and a telehealth practice that serves the entire state of California. I am in week 2 of our Perimenopause Awareness Month, and I'm going to continue to dispel some of the myths that surround perimenopause. Okay, so oftentimes patients who come in to see me will mention that when they mentioned and brought up their symptoms of perimenopause to other providers, they were met with, you're too young. Well, we have done menopause math together. And so taking it through again, we realize that perimenopause can start as far back as 7 to 10 years prior to that last year of the period. So let's do a little math here. When we look at the average age of menopause itself, we know that that average range is about 45 to 55 years old. Well, perimenopause is well documented to start as far back as maybe 7 to 10 years prior to that final transition of no periods. So let's just take the age of 45. If we minus 10 years, that puts us at 35 years old. What about my 40 to 45-year-olds who are, by definition, menopausal? Their blood work also reveals that to be the case. Symptomology also confirms that as well. So imagine their perimenopause can even start as far back as late 20s, maybe even early 30s. So it's not impossible for perimenopause to start in a younger adult. Well, let me tell you, I have patients who are, by definition, symptomology, and blood work, menopausal between the ages of 40 and 45. So imagine when a 40-year-old, her perimenopause could have already started in her early 30s. So there is a myth about being too young. If we are starting to experience these effects of our hormonal fluctuations, they can show up in our early to mid 30s. It's not impossible. Recognizing the symptoms of perimenopause, the more notable things like mood swings, irritability, fatigue, sleep disturbances, menstrual irregularities, joint pain, starting to have evidence of an elevated blood pressure, palpitations, anxiety, depressed thoughts, maybe problems with urinating, pain with intercourse, vaginal dryness, loss of sensitivity. All of these things and many more can make up some of the early signs of perimenopause. So don't be fooled about the age. It can happen at any time. If your provider tells you that you're too young, honestly, it's not that impossible. It can start early in the 30s, last for another 10 years. Menopause can start certainly in the 40s, on average between the ages of 45 and 55. But don't be fooled. You're never too young.